Dr. Malte, can you tell us a little bit about your journey in healthcare as well as your contributions to the space?
Well, yeah, thank you. I've been a heart surgeon for now over a decade. Um, I'm French Canadian in origin. I've been trained in Montreal, then moved to Nashville after training to help grow a heart transplant program, which was my specialty. And then was fortunate enough to be recruited to the Mayo Clinic in Rochester, where there I continued to treat patients with heart transplant and mechanical support. Also did some robotic surgery as well there. So very fortunate to be able to do that. Helped a lot of patients. Also have a special interest for research. Published papers in the field related to heart surgery and clinical research. And then most recently, I guess over the last 2 years, really a special interest into mental health and specifically in areas where people are functioning in high intensity environment, healthcare being one, and that book is really focused on healthcare, but I'll also have a special coaching, life and health coaching in sort of advanced environments where people have to perform and things are and sort of be in balance with.
Right. So can you tell us a little bit more about your book? So I understand it's called Healthcare Anonymous. Is that right?
Yeah, that's right. Well, it started with a personal journey. Myself went through personal and professional challenges, and then going through that and starting to talk to partners and colleagues, realized that I was not alone. And so one thing led to another. I decided to start writing. And so I got up before work in the morning, wrote a little bit every day, and then asked some collaborators to participate into sharing their journey. And it took about a year and a half, and it became a book. And in the book, we really describe healthcare as a disease, basically, and that's pretty unique, being in an environment that you heal people, but also being in an environment that perhaps is making you sick. And so we describe how this balance between your workplace and the way you were trained and the way and the so you have your management of your schedule and the responsibilities that comes with it is gradually chipping your personal life away in some instances, and leads to the main part of the book where we describe manifestation of the healthcare disease, where whether it's psychological, behavioral, physical, even. It could be depression, could be burnout, could be physical expression of stress, where people share their experiences. And then at the end of the book, like any healthcare problem or diseases, our group or my book proposes a recovery program. How, it starts with me, of course, but how this has helped, how did I sort of work towards myself to make it better?
Right. So when you talk about this recovery program, what can you share with our listeners who are perhaps feeling the burden of a workplace that doesn't prioritize wellness, particularly the healthcare environment, as you mentioned, right? There's high levels of burnout. So for those individuals who are seeking recovery, what are some insights that you can share?
Yeah, it starts with I propose a 5-step program, and whether you want to follow that or not, that's okay. But the
Right.
first step is for me, it was really to take a pause and take a step back. And because, what your life in general is a rat race, there's family, there's finances, there's work. There's always more work in healthcare, like a lot of other professions. And so it's really to take a pause. And for me, it was an extended pause to personally sort of get back to my own values and what was important for me, but to slow things down. And then what I mean that is maybe assessing what are your priorities in the work? Why are you doing that job? And what makes you happy or not? What percentage of your life is work taking? And for me, it was traveling, 30,000 mile a year to give presentations. It was from being there from 6 o'clock to 8 for patients. You can see how it doesn't leave much place for anything else. So that was the first step. And then realizing that we're just human, right? Especially within this pandemic, unfortunately, there's a lot of suffering out there. And realizing that, for me, I wasn't God and I couldn't play God. And then there are things that I do to the best of my ability, and ultimately patients won't do it, and that's a hard time that's difficult to sort of go through, but establishing those priorities is important. And I guess without selling all the scoops, my third probably best advice would be to start, talking about it and feeling it. And when I talk about this, I talk about empathy, and because you get to at some point being just in a system where you just work, and lack of empathy at different levels, whether it's not wanting to spend some time with families, or building this armor around yourself where, nothing phases you, is a initial sign, in my opinion, of burnout. And when you stop caring. And so sort of maybe reminding yourself why you're in this sort of environment. And then where are you at in that sort of spectrum of empathy? And to me, that was a revelation, because patients were and the disease patients were a room number. I was getting through my days without getting to know them necessarily, and slowing down and realizing that was an important point for me was a key to my recovery, and a lot of other collaborators in the book.
Absolutely. I think this idea of building armor around ourselves can be a telltale sign that you might be on the cusp of burnout. As you mentioned, you stop caring, right? And there's that lack of empathy, and you're kind of just going, I guess, through autopilot. And that's a really interesting sign. Curious to know, you kind of mentioned this already, but we hear about North Americans having access to sick care systems, not healthcare systems. So would you agree with this distinction, and how would you describe that?
Yeah, it's a complicated one. I've worked in two different systems, both the Canadian system and US systems, very different from a payer, from a global sort of reimbursement standpoint. I'd say now a lot of when you say sick system, evolves around making the bottom line. And I think while it's not obvious out there we always do it in the most altruistic way. We're there to help patients. There's a big wave of sort of whether you make the bottom line or not, and whether the plus and minuses add up. And so it's seeing more patients, it's seeing patients in multiple hospitals. It's sometimes, being dictated, and I know that's state dependent, but being dictated by a payer, who is going to do the operation, where is going to be the operation, what's the extent of the operation or the service you're going to provide. So to me that is a significant issue, and it gets, over the last 10 to 15 years, and we discussed this a little bit in the book, the system has changed to be, and for the better or worse, I think, but used to be run by physicians and clinicians a lot, and nurses. Now the system has changed to be run by administrators and perhaps policies and perhaps C-suite executives. So, which sometimes physicians are part of, sometimes are not, and so that is to me, that puts another layer of things for any healthcare worker, whether it's for physicians or nurses, because it adds a layer of documentation, it adds a layer of computer work, of HR related sort of issues. And I think those things are important, but I think maybe because of 20 years ago, sort of issues, now we swing the other way a little bit to really focus on the money, on the bottom line, on the hyper reporting of issues within the system. And so you constantly feel like you're in a battle between doing enough but not sort of being burnt out, or doing enough and not being reported. And so there's a lot of sort of this the legal sort of practice of medicine that I think is endemic to the system, which makes it hard to work with.
Right. So what I'm hearing is a lot of red tape and bureaucracy, and doctors not being able to necessarily focus on treating patients so much as avoiding potential legal issues and kind of getting swamped in the administrative side of things, which ultimately I can see how that contributes to burnout, particularly in that role. So what advice would you have for hospitals and any other healthcare environments that might be wanting to tackle burnout and improve workplace culture?
Yeah, thank you. That's a good question. I think and we have also a program that we're developing for systems to address that. But I think it's realizing that whenever there is a presentation of a problem, whether it's burnout, whether it's the culture of the environment, whether it's a physical issue, it's the end result of something. It's not an acute problem that perhaps resources can deal with, because hospitals have systems usually, most of them, to say, okay, well, I have a problem, then I'm going to go to this program or wellness program and things get better so I can get checked off and be better back to work. But it's more than that, because if we keep putting band-aids on problems, then it will repeat itself, and it transfers the anxiety and the stress to the healthcare workers. I think where systems would improve upon would be to establish a system for where they continuously or on a prospective basis evaluate those issues, whether people are happy with work, whether they take time for themselves, whether they have appropriate areas for activity, meditation, gratitude, and that could be done at work. Some of these tech companies are a bit more forward with that, having spaces or dedicated time for people to be a bit healthier. And I think some hospitals are starting to do that, but having a formalized assessment of your workplace, sometimes it could be as simple as allowing people once a week to wear something different, or to have a forum for them to express in a non sort of reprimandable area, where they can express some of these issues without fear of retaliation. So little things that help prospectively prevent the event where you need really acute help. And that needs to be there as well, but some of these little things can really make a difference. Understanding your people, favoring communication as opposed to reporting between folks. I think that's another important area. And yeah, that would be my being a bit more proactive in the system to recognize those issues. And sorry, I get on the things here, but you could also imagine it could be even before that in training as a medical student. How can you sort of integrate these check boxes to be better in the system?
Right, absolutely. I think there's some really great insights there. Appreciate you sharing. One specific one that I would love to talk about is when we talk about communication versus sort of reprimanding individuals, right? So being really proactive in communicating. What are some examples that come up there, or how can you expand on that point?
Yeah, I mean, there's all kinds of level of communication, right? The way you communicate with your peers, the way you communicate with your bosses, with people you're the bosses from. And so the having the ability to sort of have a open communication is critical, and in all aspects of it. And I just think about examples within my my practice. So people should feel the ability to speak up. I wasn't always that sort of open-minded, let's put it like that, to criticism or other people that tell me what to do.
Right.
Way better now. But I've realized over time that the ability for people to speak up is really improving efficiency and decreases mistake, and it empowers everybody to feel better about a process. Because as maybe the captain of the boat during an operation or during a selection committee, you are responsible for making decisions, but they should be based on everybody's ability to speak up. And if you fear this sense that people can't speak about their professional abilities, then it really puts a big dent on professional satisfaction, on workplace sort of satisfaction, and it does have an impact on your leadership and on the turnover. And having an ability to sort of mitigate those things is, to me, I think is the key. And so being able to sit down and talk about important things on a regular basis, on a scheduled basis, and having other people have the ability to speak up is to me a critical portion of it. So
that's great. And I think, just to piggyback off of your last sentence, having people on your team be able to speak up. So let's say there's some leaders who feel that they're not hearing enough from their team and they might not be sure why. Are there examples or remedies there that you think leaders can do to kind of get their team to speak up? And how do we get people comfortable owning their voice and really sharing their full professional capability, as you mentioned?
Yeah, a couple of things. Of course, it could be an entire podcast about it, but
right.
I think one simple things for me was to learn people's name. That seems simple, their first name, and not for the sake of it, but for the sake of having them feel like they're part of the team. I mean, the craziest thing, and I was guilty myself, is to work with people 10 hours a day, for 5 years or 20 years, even, and then not know their name, really.
Oh, wow.
That is an important part of being part of a team. I know from my specific field of heart surgery and other situations where, people lose a patient or things, is really being part of a debriefing, understanding what people went through, what are some of the issues, how can we make things better as a team? That to me has become one of the centerpiece of my practice in every aspects. And I feel like it's been very powerful into empowering the team. There's nothing like a quarterback type leadership, right? So having the ability to play more like a team player as a leader, and understanding what type of leadership works for your environment, I think is critical. And by that, I mean, avoiding the top-down decisions, favoring consensus-driven decisions. And that's one of the things that working at the Mayo Clinic was great about, making sure that there was a consensus decision among people, whether it's for hiring, policies, decision-making. And I think that is really powerful, because then you really get people on board with a specific project. And the worst for, I think, an employer or a leader is to have people feel like it's a top-down relationship. And that's okay as long as things work, but the minute it doesn't, then that relationship is fragmented, and it becomes really hard to understand what people feel at the battleground level,
Oh, yeah.
For lack of better words, because especially during COVID, there was a number of situations where, what the administration and the hospital wanted was different for what was happening on the ground, people dealing with resources issues and scheduling issues and sleep issues and things. And so understanding that there's this has to be this bidirectional relationship is important.
Absolutely. I can see how a lot of the times, as you mentioned, when things are working well, maybe the top-down approach, people don't have too much to say about it. But the moment things aren't working, I think, there's all this buildup that just kind of erupts. So it's really important to be proactive about that consensus-driven decision making, as you mentioned, in teams. Thinking
And
over your,
eruption, sorry, the eruption
oh
is
yeah.
the symptom. It's not
Mm,
it's like when you when you have cancer or we have heart disease, it's because maybe you have family history of you smoked all your life, or you're diabetic, or you've been exposed to radiation or something. But the end result, when it manifests itself, whether it's a crisis, whether it's people quitting, whether it's
mhm.
turnover, it's the end result of a process of a disease before. And understanding that process is the key to maybe not eliminating eruptions, like you said, but
Hmm.
making it a bit sort of a less of a big volcano.
Right, right. Whatever we can do to land a little smoothly, a bit more smoothly is important. So being proactive, I think, is a great message. Looking back at your career, what would you say has been the most impactful advice that you've received and that you'd like to pass on?
Um, I think one of the advice, and I've had advices and bad examples, and then good advice from bad examples. But
Yeah.
one of them is very specific to my career, but it was to if you do something for the patient that is genuinely the right in your mind, the right thing to do, you can never be wrong, because a lot of
Mm,
times there's decision to make. So if you do genuinely things that is done for the right reasons,
mhm,
the patient, your coworkers will see it as a positive sum game. Um,
mhm,
and that time, sometimes that's a hard one, because there's all kinds of factors that play into a decision, but ultimately that simplifies it quite a bit. Um, and then I guess the other one that I heard more recently that I thought was a good analogy is, it's not for any career that is, whether you're in professional sports or business or musician, um, life is not a sprint, and
mhm.
it's a marathon, right?
Yeah.
And so for me, a lot of times it felt like a sprint. It was to publish the most papers, be on every single podium, be the busiest surgeon in the world, and work at the most prestigious institution in the world. And ultimately, nobody brings their CV to their funeral, right?
Exactly.
And
Yeah.
it's about the people that love you, the people that you love, and how you make people feel. And so,
Mhm,
and so that is being lost a little bit. And it's not necessarily always on the individual; it's on the system and on the culture.
mhm.
It was always in training how many cases you could be on, how many hours you could be up. I mean, you look on TV, the culture portrays these sort of superhuman doctors.
Mhm.
Whether you watch The Resident, ER, or any of those, have you ever seen a heart surgeon in those episodes that is
Right.
a genuinely nice guy? I mean, it's they're all like superhuman, sort of angry people, and then you expect people to work in this environment and be any different. and
Mhm,
uh, and so looking back, I think maybe recognizing that perhaps personalities are better fitted for certain types of profession. I love what I do, don't get me wrong,
mhm,
but maybe, I mean, my personality was really thrown into heart surgery. I mean, that's the only thing that,
mhm.
it was the I was going to go to the best profession I could be in. And sometimes if I reflect, I have a certain now interest for other things, and I'm in a different stage in my life, and so
Mhm.
maybe there's things that I could have done that would have been a better sort of use of my talent, so to speak. And so maybe early on in training, having better guidance to students or to nurses, and to what area they would probably fit best, and then reassessing that continuously. Sorry, I diverge on your question here, but
Mhm.
being able to sort of, at a lot of times in your career take pauses and checkpoints to say, okay, is this making me happy? And if it doesn't, well, sometimes the solution is, and the answer is usually pretty easy. For me, it was anyway. I still practice archery, but in much different way, you know?
Wow. Yeah, no, I think that's a really great point, is to have these checkpoints and pauses and reassess, because life is long and your career journey is long. So to kind of tie it back to what you were saying initially, we hear about, life is not a sprint, it's a marathon. But in order to really practice that in your career, it's really integral to take pauses, but to ask yourself the right questions, right? So that question would be, am I happy with what I'm doing? Am I making the impact that I want to make? Does my life look the way that I want it to look like, right? Because a big part of the reason why we do the work that we do is to design the life that we want. And those are questions that nobody necessarily taps us on the shoulder and asks us. So it's really on us to ask those questions. But to your point, having maybe some mentors or coaches or individuals in the industry that can, pass that on to more junior team members and get them into the practice of really doing that reflection, can be such a game changer for so many individuals in the workforce.
And it's not an easy, it's not a very, I wouldn't say powerful, but it's not a cool thing to pass on. You pass on a technique, you pass on knowledge, but passing on this ability to be happy and this ability to, I call in the book, virus scan yourself, with no intended on the virus and thing, but virus scan yourself, and being able to recognize the symptoms of the disease and say, okay, now if I feel like my mind's racing, I can't sleep, if I feel like I'm eating off the corner of a desk all the time because my time, maybe it's time to start saying no to some things. And saying no is actually not easy, but it's pretty fun.
Once you get into the habit, right?
It's pretty fun. Or, there's all kinds of ways of saying it. Say, you can say, well, let me just assess because I used to say yes all the time. I mean, I say, yeah, I can do this presentation. Yeah, I can do this other case. Yes, I can do this. And sometimes you need to, but a lot of times you don't need to give an immediate answer, and take a step back. And it feels great and people won't resent you when you know you can say no, and then you can provide a service that's well accomplished, more than saying yes to everything and then sort of down the road kicking the bucket of either bad outcomes or sort of an extended pause because you can't manage it anymore.
Definitely. I think that discernment is so important, and it's difficult for a lot of people who want to please and who want to be mindful of their relationships, right? So definitely being able to say no and reap the rewards of that and be able to focus and create better outcomes. People will, in the long term, generally appreciate that. Absolutely.
I fully support that.
Great. Well, last question for you, Dr. Maltais. So what keeps you motivated in your day-to-day?
Well, I'm a motivated person at the start. If I get excited about something, I get all in. So I'm not just sort of talking or thinking about getting into healthcare. Mental illness, I'm writing a book about it. I'll be, and that's part of the personality too. But keeps me motivated is to me has been always the patience, seeing the reward and seeing and giving the best of my ability in the best mind state I can. Wasn't always like that, but I can say now that the patients that I treat are getting the best out of Simon,
Right.
And it wasn't always like that. It used to be more of a, factory than a really sort of individualized treatment. And that keeps me seeing, families and sort of the results of that is really keeps me motivated. I would say that the hope of spreading a word out there is keeping me motivated. I think especially now for a lot of areas, mental illness is getting a lot of attention, and I feel like we need to act upon it if we want to do it right. Because if we just keep, as I said earlier, patching it with band-aids, I think we're going to face a major problem, especially after what we've been facing over the last 2 years. I think we're kicking the bucket down the road of issues. And I think if we start a movement of speaking up about it, not just to speak up about it, but then making actions towards it, I feel like we can really make a change.
Love that. Love that. Thank you so much.
You know, some of the things that I would like to mention is, you know, we do have a book, but we also have a site that people can go to if they want to learn more about the book. It's called healthcareanonymous.com. I think people will see that, again, the message is a one that hopefully will bring some hope to the system at this point.
Appreciate you sharing that.